Hello there. Welcome to this week's episode of Health Options, the program that not only tracks government policies on health, but gives you the information you need to make informed choices about your health. Thanks for joining us on the program. I am Rabi Abdullah. As you are aware, Nigeria received 3.92 million doses of the COVID-19 Oxford AstraZeneca vaccine on the 2nd of March, symbolic of the first tranche of about 16 million doses allocated to the country through the COVAX facility. And what has been the projection? To vaccinate an initial 20% of the population with frontline health workers, strategic leadership, and persons above the age of 50 years as priority. The overall objective is to vaccinate 70% of Nigeria's population between this year and next year. So far, over 1 million people in the country have received the first dose of the Oxford AstraZeneca COVID-19 vaccine. The second dose of the vaccine is due after 10 to 12 weeks of administration. The controversy, however, lies in the fact that the first batch of people were booked for the second dose after 12 weeks, while those who took the jab weeks later have been scheduled for second dose after 8 weeks. How do we reconcile that? When is the commencement of the second dose of the vaccine? These and more are questions begging for answers as we focus on the country's rollout of COVID-19 vaccine.
My name is Dr. Faisal Shuaib. I am the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency. Earlier today, I took my first shot of the AstraZeneca vaccine. Despite all of the delays, all of the doubts, here we are, Nigerians can finally access the vaccines. I hope that Nigerians will come out and get these vaccines because these vaccines are safe, they're effective, and they truly work. Over the course of the next few weeks, we have to continue wearing face masks. We have to do social distancing. But I know eventually once we're able to get herd immunity, then we'll be able to stop all of these non-pharmaceutical interventions. To get the vaccination, you should go to the NPHCDA website. There's a link on there that you click and you can register and schedule exactly where you want to get your vaccine.
You are watching Health Options. Let's now join the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaib, as we discuss issues around Nigeria's COVID-19 vaccination.
So the vaccination program in Nigeria, is going on very well. We've gotten feedback from different sectors of the country around how first the Presidential Task Force rolled out the vaccination program very, very effortlessly. We've gone to the states and we've seen how we've been able to reach those eligible Nigerians that we've targeted. In some parts of the country, we saw where there were some queues, but these were part of the teething problems, in the initial phases of the rollout. We expect that people who are enthusiastic will go even when it's not their time. And then because we also gave ample opportunity for Nigerians to do a walk-in. So we're not saying it is mandatory for you to register online because we clearly understand that it's not everywhere in Nigeria that people have access to handsets, to internet. So we said you can do a walk-in, when it's very convenient for you, so that we do not close the door on anybody who wants to take the vaccine. In some areas that led to queues, but one thing that the health facilities have been able to do is to organize the queues in a way that it's more orderly than in other instances. But overall, we are very confident that the work is going on. Like I've mentioned, when you compare the rates of vaccination in Nigeria with other African countries, we are heads and shoulders beyond what other countries have done. Again, this is because of the experience that we've had with the polio eradication. So we have that experience, that technological know-how, the operational know-how to deploy human resources, financial and materials to the front line. For this particular phase, we focused on the health workers, frontline workers, strategic leaders. What, as you can imagine, all of this cut across different parts of the country. So we've not started going to the last mile, which is going to each and every community. That will come in subsequent phases. That is why it might appear as if we're actually focusing on the urban areas, because as you are aware, most of the frontline health workers in the treatment centers are based in the urban centers, right? So that is where we've started with those people who are in the front line of providing care to people who are sick from COVID-19. So those are the areas we started, our other frontline health workers and the strategic leaders. So in the course of the next few weeks, you'll find out that we now begin to have mobile teams that will get to the nooks and crannies of Nigeria. So as of the last count, we've vaccinated up to 1.2 million Nigerians, and that, of course, is a number that is growing, quite, progressively. We anticipate that we will vaccinate up to 2 million Nigeria with the first doses, and then we'll get another the same 2 million Nigerians after that interval of 8 to 12 weeks. We'll now vaccinate them with their second doses. In terms of the challenges that we faced, of course, it started off with people who were over-enthusiastic, so they went to some of the health facilities. That led to some queues. We didn't want to have any queues at all, especially in urban areas such as Lagos. That is what we experienced. But we also experienced some glitches in the online registration. Of course, this is a technology that a lot of people who are in the front lines are not used to. So simple tasks such as linking the QR codes, the unique QR codes with data, that was a little bit of a challenge because a lot of the health workers and the recorders were not familiar with that. Again, we've had to institute multiple trainings to build their capacities. Like we recognize, this is the first phase. This is the beginning. This is a process of vaccination that will take up to 2 years. So we anticipated that in the first phase we will have some of these issues with technology. And actually, we anticipated even more challenges with the technology, but we are very happy that it's not as bad as we anticipated it will be, and we expect that, like we've already started saying, that the states are now getting accustomed to the platform, the electronic platform. And for us, it's not a matter of the immediate result. It's actually about the future. How do we institute an electronic data system for our immunization systems? A system where, it has integrity of data, security of data, and the people will be able to get vaccinated, whether it's COVID-19 or routine immunization for our kids. They can get vaccinated anywhere in the country. Their data is available. Even if they go abroad, that data can be provided. And therefore, people who live in rural areas, riverine areas, mountainous areas, in their villages, right? It is possible to track them and make sure that our frontline health workers are able to go to their homes and vaccinate them, because we know that it's not every rural community that has consistent access to health services. The vaccine nationalism is something that everybody is not happy about because there's nothing like a half eradication of a disease. It is either you do not eradicate the disease or you do a complete eradication. And where vaccines are available to only some countries, then it leaves other countries vulnerable, and you continue to have that vicious cycle of partial eradication, reinfection, and that is not helpful to public health. That means we're going to be here for a very long time trying to eradicate this disease, and it doesn't speak to the equity, fairness, and justice that is required, for any, global public good. So I am happy that this has been recognized, and that countries are trying to work together to see how vaccines will be made available. The COVAX facility was actually established for that same core principle, equity in the access to vaccines. So we will continue to work with all stakeholders, both in country and global entities to make sure that equity is brought to bear when it comes to COVID-19 vaccination. For us at the National Primary Healthcare Development Agency, we are very, very conscious of the need to ensure equity in the distribution of vaccines, so that irrespective of whether you are poor or rich, you have access to the vaccines, especially if you are eligible based on the different categorizations that we've made. Now, in terms of why we chose the AstraZeneca vaccine and not the Johnson & Johnson vaccine. Well, the Johnson & Johnson vaccine, first and foremost, is not widely available, right? The information that we have is, the earliest we probably will get it from the African Union. It's going to be sometime in July, right? And we cannot wait until then before we start providing vaccines to protect our frontline health workers from the death and illness from COVID-19. And then clearly the AstraZeneca vaccine is constituted in a way that it fits our cold chain requirement, right? So it can be stored between +2 and +8 degrees Celsius. And the types of cold chain equipment we have all over the country are actually those that can allow us to store vaccines in those temperatures and keep them very potent. That's very, very important. We don't want to have vaccines that are not potent. We don't want to be vaccinating our citizens with water, right? We want to be very confident that whatever vaccines we are delivering to our citizens are vaccines that are potent, they are safe, and they are effective. So in deciding to use the AstraZeneca, that is something that we considered. But we also considered the fact that the AstraZeneca pharmaceutical company was very clear to share that they did not want to make a profit from this vaccine. This is why the vaccine is relatively cheaper than other vaccines, because they did not put profit at the heart of their commercialization of this product. So if it is cheaper for all Nigerians, then why would we want to go and buy a more expensive vaccine just because it is more expensive, right? What we put in as a focus is the fact that it is safe, that it is effective, and that it is available. If a vaccine is not available, then what use is it to our citizens, right? And we're hopeful that in the near future, as vaccines become more and more available, we'll be able to pick those vaccines that will work best for our citizens. There are a portfolio of vaccines that are out there, but it doesn't mean that it is every vaccine that will suit our operations. We're very mindful of the fact that we want to rapidly vaccinate our citizens so that we're able to begin to climb out stronger from this recession, from the restrictions in interactions that COVID-19 has brought to our citizens. Clearly, we're out of economic recession, but in order to even improve our economic indices, we need to get everybody back to work and working full stretch to build a stronger and more united nation. From an initial instance where people were, a bit skeptical, and there was online, the debates about the vaccines, we have seen in real fact, in actual day-to-day life, that Nigerians who are eligible are actually coming out en masse. We've seen large queues of individuals who are queuing up to get the vaccine, and we are going to be able to reach our targets. But if there's any independent scientific fact that compares what we're doing in Nigeria with what's happening in, say, other African countries, we're vaccinating, more than 2-3 times what other countries are vaccinating, right? So on a daily basis, for example, we're vaccinating over 90,000 individuals per day, compared to a country like South Africa that a few days ago was vaccinating just about 12,000. In Ghana, it's about the same numbers. So when you compare what we're doing in Nigeria in terms of the rapidity of coverage, in terms of the efficiency of our processes, we're doing much, much better than our African counterparts. But of course, when you compare with the more developed countries, then we're not doing as well as the developed countries are doing, clearly because we don't have the vaccines, right? Like they have stocked up and they're hoarding vaccines, in the developed countries, and those vaccines are unfortunately not available to developing countries. So they have the confidence to say they have a stockpile of vaccines, they can go at whatever pace they want to. But for us, we have to be more strategic to make sure that we have everybody covered by the first doses, and we also have the second doses available. But overall, we're actually going according to the plans that we've laid out to vaccinate all Nigerians. So it's pretty simple. We're going to be replicating what we've done in the first phase. So the first doses, the same types of communications, the same types of strategies, what we're going to be employing even for the second doses. So we're mindful of the fact that we have to give this second dose in accordance to what the World Health Organization has guided. So the second dose of the vaccine can be given to individuals between 6 to 12 weeks of the first dose, and that is the guideline that we're providing. So for a lot of the people that started the vaccination, we gave them 12 weeks. For others that came afterwards, we gave 8 weeks, which is really the same window that has been provided by the World Health Organization. But what we did as a presidential task force, the Federal Ministry of Health and the National Primary Healthcare Development Agency, is to make sure that we're not adversely affected by the drop in the global supply of AstraZeneca. You might be familiar with the fact that the Indian government is cutting down on exports of the vaccine in Europe as well. So because of those delays that we anticipate, we decided to make sure that we cover our citizens with both the first and the second doses of the vaccines, and then we will now give adequate time to get additional vaccines coming to the country. Hopefully between the end of May and June, we hope that we might be able to get additional vaccines. All states, including Kogi State, which was the last state, has been supplied with the vaccines to vaccinate the individual, and from the feedback that we're getting, that vaccination process in Kogi State is also going on very smoothly.
Recently, both the president and vice president demonstrated leadership by being among the first Nigerians to have the AstraZeneca vaccine administered to them on live TV for all in the country to see. Subsequently, many federal ministers, political leaders, and members of the Presidential COVID-19 Task Force have publicly taken the vaccine to follow in the footsteps of President Buhari and Vice President Oshibaja. To obtain it yourself, please go to the NPHCDA website. There is a link to click on in order to register and schedule your vaccination. In the meantime, please continue to wear face masks, wash your hands frequently, use hand sanitizer, and observe social distancing. This message was brought to you by the Federal Ministry of Information and Culture.
We sought clarification on vaccination in Ramadan for the benefit of our Muslim faithful.
As an agency, we don't have our personal opinions. I don't have a personal opinion on that issue. We are guided only by what the religious scholars that we interact with, that we get advice from, are saying. So, as you may be aware, religious scholars, traditional leaders, have a partnership with the National Primary Healthcare Development Agency that was very critical to our eradicating the white polio viruses. So these are the same communities, these are the same individuals that we've asked, and gotten information from around what is the best advice. And the predominant advice that we've gotten from the religious leaders is that the act of vaccination itself does not vitiate, it does not annul your Ramadan fast, right? So you can take vaccination while fasting. the explanation there is that the vaccine itself is not nutritive, it's not nutrition, and like they've also guided us that actions must be judged according to intention. So the general information that we've got advice is that we should continue our vaccination even during the Ramadan, and that is what we are going to follow. So we're not making any additional logistic arrangements for the iftar period because this is not guided by the guidance from religious scholars in Nigeria, or even religious scholars that we've spoken with outside of the country. So there's no additional effort that is being made to that because there's no basis for that.
Any intake that has to do with the system of the body, especially that has to do with digestive system, it is not allowed. Any intake in form of liquid, solid, or whatever. Therefore, injection of this same type will go into the veins, and therefore it obstructs the rules of fasting. Therefore, it is not allowed. Why not delay it till after? If there is a need to do that, why government not make a specific arrangement? For example, after iftar, rather than take it during the daytime. If it is muscle that doesn't affect system of the body, that is where the food goes, there's nothing wrong. But if it has to do, certainly it is not allowed. Even taking in Vicks, for those who have catarrh, is not allowed because it has to do with the digestive system. And therefore it must pass through the trachea. And if anything passed through the trachea, it means it has vitiated the person's fast.
I have had my own vaccine, though not in Ramadan. In Ramadan, a Muslim is not expected to allow anything into his system, stream or intravenously, as they say. But injection or the taking of the vaccine is not going into the bloodstream, it's going into the muscle of the body. So that is allowed, and that will not prevent a Muslim fasting from accepting the vaccine. Of course, you are asked questions on allergies and so on, and you are given paracetamol, I think, to be taken every 6 to 8 hours, except where the people in the field feel that a person should not take it because of his answers to some of their questions. A Muslim should be able to take the vaccine even where they are fasting.
And this is where we conclude this week's episode of Health Options. You can go to our YouTube channel to watch the uploads of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Thanks for watching. Hope to see you again.